Carlos Conde Solares joins us now from Newcastle in the UK. He's a senior lecturer in Hispanic studies at Northumbria University there. Thanks so much for joining us. Okay, I mean, with your expertise then in Spanish politics in particular, I mean, tell us how you think Spain's own system of governance, you know, with its autonomous regions and communities, have potentially hindered the response to this virus.
Yes, there's been several problems regarding Spain's response to this virus. I would like to first of all point out that the reaction of the Spanish people has been remarkable in terms of discipline, in terms of compliance with the measures, and also the reaction of the professionals, the health professionals of the army has been incredible. Yet we've had a governmental response that has very clearly failed in terms of coordination. We have very clearly had a central government that has been very often negligent when it comes to preparing for this outbreak, and I can elaborate on that if needed. And we've had, of course, the autonomous community system and the problem of devolution, both downwards to the autonomous communities and upwards, perhaps, to the European Union, that has created significant friction in both cases.
Okay, then, I mean, explain these failures you're talking about, not just at the federal level, but the devolution of power and how it really has stopped the better prevention of this pandemic in Spain.
Yeah, the Spanish Ministry of Health is an empty shell because of the extreme devolution that has taken place in Spain over the past 35, 40 years. This means that when purchasing of products was centralized to the central government, there was no experience there. There was no contacts. There was not enough knowledge really to be able to coordinate this response in an effective manner. Unfortunately, the central government, despite plenty of notice from what happened in China, from what happened in Italy, from what happened in Iran as well, decided to go ahead with mass gatherings such as those on the 8th of March, decided to go ahead without planning and without purchasing sufficient masks, without purchasing sufficient equipment. And this has resulted in a disproportionate number of infections and a disproportionate number of deaths, unfortunately. There is even talk that beyond the political and the ethical responsibilities of the government, there might very well be criminal responsibilities to be looked after after this crisis is over.
Okay, that's remarkable. I mean, Carlos, could something arguably good, come out of this, do you think, in the sense that this pandemic might show the Spanish people that the country is perhaps, stronger together rather than trying to function as, autonomous or independent states?
Indeed, that's one of the ideas that, of course, are being discussed these days. The health workers are working under incredible strain and in incredible circumstances. This is happening everywhere, but in particular in Spain, I think that it has been really moving to see. Most of the autonomous communities have behaved in solidarity. We've seen that with Galicia, with Andalusia. They have been trying to help the other autonomous communities as much as possible. Unfortunately, in some other cases, there's been regional governments that have perhaps attempted to use this crisis in order to further discredit the state. But all in all, indeed, it has been it's been a really difficult stress test for the Spanish system, yes.
Right, for the political system and the healthcare system alike. Okay, Carlos, thank you so much for joining us there. We appreciate it very much.